So thank you so much for having me. It's a pleasure to be part of this. I'm going to tell you about a project I've been working on with a whole bunch of people. You can see all their names here and a bunch of funders as well. It kind of culminated this February in a book with Penguin, and in that book we cover a lot that puts the topic I'm going to focus on in perspective. So I wanted to tell you what's in the book. First chapter is just on what is AI, but then we look at the moral problems that AI raises, some of them having to do with safety, for example, with autonomous weapons, some having to do with respecting privacy, such as social media and geographic detectors. Uh, some having to do with fairness. There we focus on criminal law and the use of AI to predict bail violations and recidivism. Uh, and some having to do with creating a responsibility gap because when a self-driving car has an accident, you don't know whether to hold the car responsible or the person who programmed it or the business or who should be responsible. So those chapters 2 through 5 really lay out a whole bunch of problems. Not that AI, is only problematic. Our overall theme is, there's good news and bad news. AI is great. And so we want to figure out how to reduce those dangers. And the last two chapters, we propose some ways to do that. So in chapter 6, we focus on how we can incorporate human moral standards into an AI system. And in chapter 7, we focus on how we can have training programs in AI businesses so that people will be more sensitive to moral concerns. But I've only got 10 minutes, so I'm going to focus on chapter 6 and how we incorporate human morality into an AI system. Of course, to do that, we got to figure out what human morality is. Uh, and then we got to figure out how can AI include human morality in the rules that it's following. The method I'm going to describe is very general, but we're going to start with just a pilot study of kidney transplants. So you've got to imagine that there are two people, each of whom need a kidney transplant. They're on dialysis now, and yet there's only one kidney available. So we've got to decide which person gets it. This, I take it, as a moral problem because it involves harm to other people and because we want to be fair in the way we distribute the kidneys. So what we want to do in our system is to have an AI system that predicts human moral judgments in that particular context. So first step is to survey lay people about which features matter and which features do not matter to who should get the kidney. Then we have to refine and supplement that list because people don't always think of everything that matters. They might have just not, overlooked it. And then we have a revised list and we have to confirm that these things really do matter. So this is just a really small pilot study. We have larger data that I could show you, but this is pretty simple. Sex and gender and race and sexual orientation. Almost everybody says they don't matter. That's why they're in red there. And should not be part of the considerations. Uh, Age, current physical health, history of alcohol consumption. Most people say it should matter. Alcohol consumption, presumably because they think that the person might be responsible for their own kidney disease. And there are going to be some in the middle that are controversial that some people think matter and others think do not matter, such as number of children and record of violent crime. And so now we've got a list of features that people think matter, some being controversial, but a lot of people think they matter. And we construct scenarios where those features conflict so that we can ask lay people who should get a kidney in those conflicts. So in this particular example, notice the features are very general features. and the scenarios are very concrete. So we're trying to wed the concrete and the general and see how they work together. So here, for example, you might favor patient A on the basis of age, because they have a longer life expectancy on average, given that they're younger. You might favor patient A on the basis of drinks, because patient B drank more, so they're more likely to be responsible for their own kidney disease. But you might favor patient B on the basis of child dependence, because if you give the kidney to patient B, you're going to be helping those two child dependents as well as patient B. Whereas patient A, you're not going to be helping any child dependents. Of course, they've still got friends and family, but they might have equally friends and family. So now, in order to determine who gets the kidney in this case, you have to weigh the importance of the child dependent feature against the other features. And so the idea is that you do a whole bunch of these scenarios, and then we can use standard AI or machine learning algorithms such as random forest, XGBoost, but also just linear regression to build a model that predicts individuals' moral judgments about who should get the kidney. And we've been able to do this pretty successfully, 90% accuracy on average. But that's just using kind of off-the-shelf AI systems. We haven't done any of the more sophisticated techniques, which would presumably get us higher than 90%. Then we, after we have the models for individuals, we can aggregate the individuals into groups. You want to predict not what some individual committee member thinks, but what the hospital ethics committee would decide. You can have a model for each member and then a model for the group as well. And you can compare the moral judgments of individuals and groups. So nobody's saying that everybody's going to make the same moral judgments. Of course not. But we can compare you to me or people in Sussex to people in North Carolina and do a lot of interesting work seeing what kind of algorithms, how the algorithms differ in their moral judgments. Of course, there's an obvious objection. What's morally right or wrong cannot be determined by a mere vote. Of course not. But why not? Well, we want to say because humans are ignorant, they don't always know the facts of the case, they're biased in ways that they themselves don't want to be biased, and they're inconsistent. They say different things on different days by mistake, a mistake that they themselves see as a mistake. So we want to correct for these different factors. In the case of correcting for ignorance, we follow the head of Thurgood Marshall, who in the capital punishment case showed that even though most people in America favored capital punishment, if they were more informed, they would not. The way you do that is you look for correlations between how much they know and how much they oppose it, but you also manipulate by giving them more information and seeing how that affects their judgments. And then you can extrapolate to what they would say if they were much better informed or even fully informed. We can also correct for bias. One solution is simply to not include the features that people think should not determine kidney allocation. So race, gender, sexual orientation, I mentioned those. Notice that our case did not include any of those. But there's still going to be indirect proxies. So for example, if you say current health and someone has diabetes, then that's going to indirectly work to the disadvantage of poorer groups, including in the US, African Americans who have higher rates of diabetes because they live in areas where they can't get appropriate foods. And so our solution to that is following Crystal Yang at Harvard, that we still use those factors, measure how much bias it is, like how much does it affect the probability of getting a kidney, and then simply correct for it so that the probabilities are going to be the same for the factors we want to do. None of that's going to be perfect because we can't correct for all of them, but we're not trying to be perfect. Nobody can be. We're trying to be better than the current system. Finally, we want to correct for inconsistency. What we've found is that in complicated cases like the one on the right, people are only consistent about 85% of the time, 80-something% of the time. This is when they get the same scenario on Monday, Tuesday, Wednesday, Thursday, Friday of 2 weeks in a row. Consistency means they give the same answer whenever they get the same scenario. Inconsistent when they don't. And what we want to say is, well, look, if they don't give the same answer, that shows that their answer doesn't really reflect their basic, consistent, stable moral judgments. And so we want to discount those judgments to the extent that they're inconsistent over time. So that gives us, we can correct for ignorance, for bias, and for inconsistency. And our argument is that AI should align with what humans would judge to be morally right or wrong if they were more informed, consistent, and unbiased. Our goal is not to tell people what's really right or wrong. It's not to replace doctors or human decisions. It's only to reduce the likely harms of AI, to help humans make fewer mistakes, that is, mistakes by their own standards, and to better understand human moral thinking. So that's a lot, but I look forward to talking about it when we get to the question and answer session. Thank you.